All right, ladies and gentlemen, Vet Talks, Dick Liberty. Who do we have on the show today?
Today's guest is Dr. Michael Hoffman of Brandbeat Neurology. Now, this doctor specializes in treating a wide range of neurological needs, including cognitive and behavioral neurology, stroke, migraine, neurotoxicology, traumatic brain injury, and war illness. Dr. Hoffman has served as chief neurology at Orlando VA Medical Center, as well as the director of cognitive neurology and stroke programs at James A. Haley VA Hospital in Tampa, Florida. Dr. Hoffman, welcome to the show. It's such a pleasure to have you here.
Thank you. Thank you. I appreciate you having me on the show.
I couldn't not have you on the show because you deal with a very specific type of medicine practice, right? And I understand that you've been doing this for roughly 35 years, that you have multiple publications, that you're considered an expert in this field of medicine. How did you get into neurology, and what brought you and your desire to heal veterans and soldiers with your neurological practices?
Well, I started out as a stroke neurologist initially, and that was fun, but I've rapidly realized that no matter how small a stroke or how brief, even if it's only a few minutes, everybody has some kind of cognitive impairment to a greater or lesser degree. And that got me into being more of a cognitive and behavioral neurologist over the years that I worked. And then I became interested particularly in war illness and traumatic brain injury in the veterans. And I signed up for my first veteran job, I think about 15 years ago at the Tampa VA. So I've always been very interested in the war-related illnesses, particularly TBI, PTSD, Gulf War illness, etc. And I've realized too that a lot of them need to be diagnosed much more accurately, because once you have a more precise diagnosis, you can then implement a precise treatment. So you can always do something for veterans.
During your experience and your time working at the VA, the different VA hospitals, how long has it taken typically for a veteran suffering, let's say, from a traumatic brain injury to be referred to and or treated by, say, neurology or yourself, Dr. Hoffman? Where does that fall in the VA's or in the soldiers' treatment plan?
Well, one of the problems I've encountered is that, particularly with war-related illness such as TBI and neurotoxicological diseases, and these include, of course, Agent Orange, Gulf War illness, Camp-Lejeune toxicity, you may have some mild cognitive impairment, but it can often be in the area of normality. For example, most centers, not only VA centers, but any tertiary center, they typically have a screening cognitive test such as the mini-mental state or the MOCA exam. And most vets can actually score on a normal range, which is above 26 out of 30 points. And then they get told, well, there's not much wrong with you and we don't need to manage you further. This often happens. And yet there can be a dramatic behavioral abnormality. So this is now within the realm of behavioral neurology. And if you do behavioral neurological tests, you sometimes find dramatic impairments, whereas the cognitive side is relatively normal. And this is something that I think is still not widely realized or understood yet or implemented. And I've written quite a bit about this. There's a recent paper that came out in January this year about my experience with my colleagues in frontotemporal syndromes and the various sub-syndromes that one can diagnose. And these are all individually treatable conditions. So that's my interest, is that we're missing a lot of things in veterans, and there's a lot we can do, much, much more. And the other side of the coin is, what about treatments? Well, device therapies, electrical, magnetic stimulation have become prolific now, and they many times are much more effective than standard pharmacological therapy, and they're also relatively free of side effects. And this is again something that's not widely known, is that there are a lot of devices out there that are highly, highly effective.
That's where you've been focusing your research, especially after the environmental dependency syndrome paper that you wrote about. Is that correct?
Yes, correct.
Before we move on to that research, I want to ask one quick question in regards to the assessment of the soldier that you were speaking of. Do you think it would be fair to say that because of military culture and the way that it's portrayed that you may be weak if you admit to having some sort of PTSD or some sort of, let's say, behavioral impairment, that the soldier themselves are maybe ashamed or don't feel adequate, so they hide that during assessment? Is
Yes,
that
absolutely. Yeah. You know, traumatic brain injury is the one that comes to mind because so many of our veterans have suffered TBIs. And it doesn't have to be any dramatic injury which causes loss of consciousness. Even blast injuries now are known to affect the brain and sometimes can stay there forever and even get worse over time. So you don't even have to lose consciousness to have a significant traumatic brain injury. And even the people who do the what is it called when you have to search buildings and you have to implode the doors?
when you're doing the breaching and clearing operations?
Breaching, exactly. So breaching. So that shock wave from breaching too has the similar effect of a blast injury.
Okay.
And it's something that's not well known at all, is that even one concussion can cause lifelong problems and get worse. So the teaching used to be that, and you'll still come across it a lot today, that once you've had a concussion, you recover within days to weeks. So that is true for many people, but probably just as many, they have lingering problems for weeks, months, years, and even longer. And they can be significant.
What is the greatest impact you've seen from one of these types of injuries and or cognitive impairments on the family members? Because I know family members and the communication between the family members and the soldier can be very challenging, especially when that soldier is, let's say, being medically discharged and going through this process from the military and through the VA. What are some of the things that you've seen that impact the families the most, and what advice could you give family members to help their soldier get through this kind of process?
Yeah, very good point. You know, very often the caregiver or family member suffers even more than the veteran or the soldier. And a lot of it has to do with the fact that the behavioral abnormalities that can ensue after a head injury or any brain injury for that matter, they can be subtle. I like to use the term neurological stealth syndromes. So the family members know there's something not right, and they tell the doctors, but you know, the words don't fit, and it's difficult to describe. And what of course they're referring to is that behavioral neurological sequelae after a TBI take the form of disinhibition syndromes, lack of we call it abulia, poverty of thought, action, and speech. People become less empathetic, so they can become very hardened towards their spouse, for example, show no empathy anymore or very little. And these are very, very difficult things to understand when you've never heard that these things can just manifest after a TBI. So the reason why I've spent so much time in this particular area of neurology is that although there's between 6 and 8 major neuropsychological domains that get tested by neuropsychologists, and these are things like episodic memory, working memory, executive function, visuospatial function. These are the 6 or 7 major neuropsychological domains. Veterans can often score normal or near normal in those domains. But when you start the behavioral neurological evaluation, and there's over 300 different kinds of behavioral neurological syndromes. Fancy that. And you have to know about them because you may be missing one or more of those. And they have their own tests available. Many of them are questionnaire based. There's very few formal tests, but there are certainly well-described neurological behavioral syndromes that you can look up yourself. And you can diagnose them, and many of them are associated with various kinds of treatments. And once you explain to the family member, well, this is not really the soldier's fault, it's because he has a disrupted brain circuitry, and that's causing him to behave like that because the brain circuits that put a hold on certain behaviors are no longer there, and therefore they behave in a strange fashion. So that's really what we're talking about.
Okay. Now, the Gamma device, these are the tools that you've helped develop and be a part of for treatment of these cognitive dysfunctions and things of that nature, and to offset some of that. Can you tell us a little bit more about that so that maybe we can highlight a potential new avenue that veterans could attempt to help alleviate some of their issues when it comes to PTSD or TBI or any nature of those things?
Yeah, certainly. The Gamma Core Sapphire device, which was developed by a company called ElectroCore, I've been using it in the VA for about the last 6 years to treat migraines, cluster headaches, and it's FDA approved for 9 different headache disorders now. And we found it dramatically effective, because one of the main reasons I started using it is because when you see a veteran who has cognitive impairment and severe migraines, which occur in almost all of them after TBI, many doctors give them various kinds of medications. They're often not effective. And so the veteran comes in, or the soldier comes in, with a dozen or more different medications. And the first thing they say to you, please, doc, don't give me another medicine. So hence I tried these devices, and I've had many veterans respond within 5-10 minutes sitting in front of me. The migraines are gone, or they've dramatically improved. And it's a device that uses electrical and magnetic stimulation, which you apply for 4 minutes to the side of the neck, to the vagus nerve. And you can use it for acute migraine attacks and also to prevent them, so as a prophylactic. More recently, it had accelerated approval by the FDA again for PTSD, post-traumatic stress disorder. It's also there's been reports about it being used for COVID because it has a powerful anti-inflammatory effect, for improving cognition and even learning a second language. So the effects on the brain are widespread. Now, it's not the only device out there. I've also been using devices that use triple therapies such as laser, LED lights, and TENS units, a device called Neurolumen for severe neck and back pain and peripheral neuropathy. So yeah, it's yet another device therapy. And there's many others. Psychiatry uses a lot of transcranial magnetic stimulation for refractory depression, also very effective. And these therapies have almost no side effects.
Dr. Hoffman, real quick from the veteran community, what is the fastest and easiest way for a veteran to get diagnosed?
Well, that's a big problem, because the typical wait time in the veteran system for neurology is plus minus 6 months. That's when I last worked there. It can even be longer. And that's one of the reasons why, when I retired officially in about 2-3 years ago, I set up a specific behavioral neurological practice called Brainbeat Neurology. And I'm now in the process of transferring my skills to Florida Atlantic University in Boca Raton, where I'll be joining as full-time faculty as chief or director of behavioral and cognitive neurology there.
And the alma mater, FAU is my alma mater.
Oh,
Let
really?
me ask you a question, Dr. Hoffman.
Yeah.
Is there some way that you could tell our viewers and listeners right now anything they could do as an at-home diagnostic test. One. Second, if they can't do an at-home diagnostic test and they're already in the VA system, they need to request from their primary care an appointment with neurology, is what you're saying, correct, sir?
Yes.
Thank you.
Yes.
And if they can't get an appointment with neurology, do you have an at-home diagnostic test they could do?
Well, I can put on a website the tests that I use. And many of these tests can very easily be implemented by a provider. Doesn't have to be a behavioral neurologist. It could be a general neurologist or even the primary care doc for that matter. That can be done.
Are they aware of that, or is that just something that's overlooked and not common knowledge?
It's overlooked and not common knowledge, yeah.
So speaking about the gamma technology, now we had a discussion a couple of days ago when I brought forth what is the difference between, or why is it that the neurons in the spine aren't treated concurrently during the brainwave therapy sessions?
So I'm trying to understand the question. Brainwave therapy special?
So I've noticed, how there's been tests where they monitor the brain waves and they're watching what's going on during
the EEG.
With the EKG.
Yeah.
I'm not sure if that's specifically targeting or just monitoring on the brain waves. My question was, what is the application for the gamma frequencies auditorily through the ears that you could essentially treat and clear the neurons in the central nervous system of the spine?
Oh, I see. I get it. Right. So there's been a discovery, and we've known this for many years, that when you do EEG recordings, brainwave recordings, that we used to speak about alpha, beta, and delta waves, theta and delta waves. So these are frequencies between 1 and say 12 to 13 hertz frequency. But people have long known that there were so-called gamma waves, which are between 40 and 120 hertz. So very fast waves that seem to occur quite frequently as well. But we never really knew what they meant. And now we know that if we apply 40 hertz stimulation, either through visual means or sound waves, all right? So in mice, the studies have shown that can lead to a 60% reduction in Alzheimer's disease, for example. It seems to open the lymphatic system in the brain, flushes out metabolic waste, improves sleep as well. So gamma therapy is now a new venture of treating a lot of different neurological diseases, because it's a kind of way of tacking into the brain networks, stimulating the brain networks, speaking to them in a sense. And if you look it up, 40 hertz therapy looks very, very promising for a wide range of disorders. There's already a device, it's marketed out of California, that uses 40 hertz sound therapy to help you sleep. And I've actually given that to a couple of veterans already. And I've had one veteran in particular who, since his Vietnam experience, never slept more than 2 to 3 hours a night, and now he sleeps 5 to 6 hours a night. So that's a little anecdote, and I've had many more reports like it. So yes, these different kinds of device therapies, including 40 hertz therapies, are extremely promising.
Right. Now, you talked about you're going to the University of South Florida. Is that correct?
No, Florida Atlantic University in Boca Raton.
Florida Atlantic University in Boca Raton. Now that you're being brought on as a full-time professor and for the neurology department, do you have any, what is your primary mission with this appointment? Is the first question. And then the second question is, do you have any concern or anything you're worried about in regards to what's going on the college campuses across the nation right now?
Yeah, I've seen that disruption. Well, that's often outside factors that are instigating this. That's all I know at the moment. What I hope to achieve with my position is to provide an even better opportunity for not only veterans, but anybody in the community to be exposed to behavioral neurological teaching and thinking, diagnosis and treatment. I mean, that would be the ultimate aim of that.
Okay. Do you have any plans like community events, coordination with VA, host events, anything of that nature?
Oh,
Type of
yes.
talk?
Absolutely. You know, as soon as I start on the 1st of July, that will be one of my major aims is to make this much more known to everybody and what can be done.
Excellent. Well, I would love to help you in any way that I can. So it was
Thank you.
great to have you here today. Is there anything else that you'd like to share with us in parting wisdom or things to come that maybe
Yes.
resources for veterans that they could find?
Yes, listen to Vet Talks, because this is one way, and thank you for inviting me, one way of getting the word out there. And I don't know how wide your readership or listening community is, but this is definitely a good start.
Ladies and gentlemen, Vet Talks. Stay tuned.